Hi everyone, here's my third vlog that will discuss the limitations two athletes present in the squat exercise. The first athlete displays a limitation due to a lack of skill. When squatting, the athlete fails to achieve full squat depth as a result of initiating the movement with a knee bend, resulting in a significant anterior translation of the knees in relation to the ankle joint. This leads to the athlete's heels leaving the floor as she attempts to ensure her centre of mass maintains within her base of support. Initiating the squat in this manner has led to the depth of the athlete's squat being limited by the range of motion present at the ankle. Despite that, with this athlete's current squat pattern, looking to increase ankle range of motion is unlikely to yield any further improvements in squat depth. When looking at this athlete from the frontal plane, it is apparent the athlete has a very narrow stance and relies only on the hinge-like properties of the ankle, knee and hip in order to squat. To improve this, it would be suggested that the athlete adopt a wider stance with her feet slightly wider than shoulder width, with the toes outturned no further than a 5-to-1 position. Having addressed the athlete's starting position, focusing again on coaching the limitation of a knee-dominant descent strategy should be the priority. Verbal cues such as sit back or reach back with the hips would be appropriate at this time. Drills such as wall taps also help teach a hip hinge movement strategy. Tempo squatting to a box, where the athlete is encouraged to exaggerate the eccentric portion of the lift, may also help teach the hip hinge pattern in combination with cues of sit back or slowly lower to the box. Also, utilising this counterbalance squat, as demonstrated, may also help the athlete maintain her centre of mass within her base of support whilst learning to sit back into the squat. Having addressed the athlete's starting position and initiation pattern, it is now clear that the athlete can sit into a deeper squat on the right as a result of a rearward movement of the hips. In order to achieve further improvements in the athlete's ability to perform a full squat, where the centre of the hip joint is slightly below the centre of the knee joint, assisted squatting may help teach the athlete the correct descent pattern. Following improvements in the athlete's starting position and descent strategy, from the frontal plane it's clear the athlete displays some dynamic valgus on our left side, which would ultimately limit the load this athlete could safely tolerate. When a band is placed around the knees, the athlete automatically adjusts their descent strategy, emphasising external rotation of her hips, thus allowing the pelvis to move forwards towards the apex of the squat, allowing for a full squat to be performed, by allowing the athlete's centre of mass to stay within her base of support. Appropriate cues to encourage this would be knees out or spread the floor. In contrast, the second athlete displays limitations in the squat pattern due to a lack of capacity. From the sagittal plane, it would appear this athlete's level of squatting skill is relatively good, with the rearward movement of the hips initiating the movement and ensuring the centre of mass remains within the base of support. However, from the frontal plane, it would appear that this athlete displays an asymmetrical squat pattern, accessing a greater degree of external rotation at the right hip compared to the left hip, as shown by the following image, which shows the centre of the knee joint to be further away from the centre line of the body on the right side. Also from behind, it appears that the right hip does not descend as low as the left hip, and that left lateral shift is further indicated by the bar path away from the centre line of the body. When performing an active hip flexion test, it is apparent that this may be due to a lack of range of motion at the right hip compared to the left, with a 21-degree difference between both sides. This imbalance appears to be driving the athlete to access a greater degree of external rotation at the right hip as a compensatory strategy for a lack of flexion capacity. In order to improve this, it would be recommended that this athlete complete a series of exercises designed to improve the mobility of the tissues around that right hip. Including foam rolling complexes in warm-ups may be an adequate solution to this. In addition to this, static stretching exercises such as this glute stretch or this hip flexor stretch with band distraction may help improve the quality of some of the tissues surrounding the hip joint. Also including active mobility drills such as hurdle drills should also help improve range of motion. In addition to the mobility work, it would be recommended that this athlete complete a series of unilateral strength exercises designed to strengthen the weaker right side, which may have resulted from years of squatting with an asymmetrical squat pattern with a greater emphasis on the left side, as shown on the earlier clips.